And so next we're going to be talking about a big study that you're going to be talking about on Monday, the SunRISe-4 study. Could you tell us a little bit about the trial design for SunRISe-4?
Yes, SunRISe-4 is a randomized phase 2 study testing two different approaches in patients with T2, T4, M0 muscle-invasive bladder cancer who are unsuited for or refuse neoadjuvant cisplatin-based chemotherapy. This is a non-comparative study, so two parallel arms testing the combination of TAR-200, which is a gemcitabine intravesical delivery system, which is providing gemcitabine release through a silicone tube that is put through a catheter into the bladder and substituted and removed every 3 weeks in combination with an immune checkpoint inhibitor, an anti-PD-1 agent, cetrelimab, or cetrelimab monotherapy in the second cohort. The study is almost close to accrual, so the data that we presented at the meeting are relative to an interim analysis of the study on the first 80 patients randomized. The data are quite promising because the pathological complete response rate, which is the primary endpoint for the study, was 42% in the combination therapy arm in all comers, and the pathological downstaging, so the downstaging to non-muscle invasive disease at the radical cystectomy examination was up to 60% in the combination therapy, while for cetrelimab monotherapy, path CR was 23%. In particular, we investigated the results in subgroups of patients, in particular considering the clinical T-stage at presentation or completeness of previous TURBT prior to start therapy. And in clinical T2 and M0 population, the PCR rate rise to almost 50%, 48%, and the pathological downstaging up to almost 70%. So quite promising in this particular population, and the results seem to be consistent regardless of the completeness of previous TURBT. So also patients with pre-existing visible residual disease prior to start therapy benefited the same from the neoadjuvant therapy. Lastly, the results were suggesting that there was an association between the exposure of TAR-200 and pathological response. Patients who were able, and who were the majority at the end, who were able to get the full 4 courses of TAR-200 and cetrelimab benefited with the path CR that rise to up to 50%. So it is also an important point that we will likely require a learning curve by urologists in optimizing the management of TAR-200 in their patients. And the drug and the combination therapy was really quite safe and tolerable. The rate of treatment-related adverse events, severe adverse events, was very low, in the range of 10%, so quite really manageable. So overall, based on the preliminary safety and efficacy results, it could be a further opportunity for the patients if confirmed in the final results of the study.
That's very promising and very exciting to have more data for patients, like you indicated, that are muscle invasive and either cannot get neoadjuvant chemotherapy or decline to receive it. And so we've seen a lot about these pretzel devices in the non-muscle invasive space in the last few years. And to your point, it seems like perhaps some of the safety issues, because it's a locally released therapy, it will be quite tolerable. And I think it will be great to have another option for patients that cannot receive neoadjuvant chemotherapy.
Yeah, as you mentioned, SunRISe-4 SunRISe is a platform study. SunRISe-4 is just a piece of the multiple trials. You mentioned SunRISe-1. Actually, the same combination provided the results in non-muscle invasive disease. So it's a continuous process aiming to get newer therapies for the continuum of the clinical stages from T1 to T2, T4 disease. Yeah.
Wonderful. Well, thank you so much for joining us today, and looking forward to the presentation.
Thank you. It was a pleasure.